It's not even about optimization, it's how do we get you to feel like yourself, like the best version of yourself.
Welcome.
Thank you
for coming.
Thanks for having me.
We are here with Dr. Kelly Bender. So you are a naturopath here in Los Angeles. Let's, I guess, start a little bit. Just tell us a little bit about your practice, why you're here. What we're going to be talking about peptides, but I want to get a little background from you first.
Yeah, so I'm a naturopathic doctor, which in California is a little bit different than a naturopath. So naturopathic doctors go to a 4-year medical school. We have boards. We're licensed. We can prescribe all those types of things. I see patients in Brentwood. I have a clinic that you've been to.
Yes, it's amazing.
Thank you. And we try to help people figure out kind of where their health got off the rails, how that happened, and how to get back on. So we have people who come in, they've seen lots of other doctors who tell them, you're fine. And nothing's wrong with you, your labs are all fine.
This is normal for you.
This is normal aging, which you're gonna talk about. And people realize that this is not normal, right? They don't feel like themselves. They know that there's something wrong, that there's something going on. So a lot of times they'll end up coming in to see us and we do some digging and try to figure out exactly what's going on. And sometimes it's a lot subtler than, oh, you have diabetes or you have irritable bowel syndrome, which are things that a lot of times we can catch on normal blood tests or normal exams. So we try to find out kind of how to optimize. I know we've talked a lot about this, kind of how to optimize people, but really for me, it's not even about optimization. It's how do we get you to feel like yourself, like the best version of yourself.
Because it's different for everybody.
It's different for everybody, and lab tests are different for everybody, right? Like the lab ranges are so wide. Some people can have low normal levels of hormones, and that's fine, and they feel good on that. And some people can have low normal levels of hormones, but they feel really crappy, and they would feel better if they had higher amounts. And maybe when they were younger, their body was producing higher amounts.
So it's not pushing away the normal process of aging. It's easy to explain away those symptoms with that verbiage.
Exactly. A lot of people, for probably thousands of years, humans have lived into their 40s, 50s. Now we're living longer, and so what we expect as normal aging, a lot of people think you have less energy, your memory starts to go. It's really common, especially here in the States, for people to get ages of diseases of chronic lifestyle, right?
Yeah.
So a lot of people in their 50s, 60s, they'll start getting diabetes. The older you are, the higher risk of like dementia, cancer, high cholesterol, hypertension, all these types of things. And sometimes it's the body's processes are starting to slow down, and that can be somewhat normal. But a lot of times there are things we can do to restore your body back to what it was, in your 30s, 40s, at least help you feel that way.
Right, because feeling awful does not have to be a part of the aging process.
Absolutely not.
And there's a difference between, I'm, aging, so there's certain physiological processes that change during that period versus, no, you just were exposed to something awful for a long period of time and now you're experiencing the chronic effects of that. And it takes a professional to be able to break that down, see what's going to be relevant for you and your health, and help you move through that. So, all right, well, I want to talk about peptides with you today because this is something we get into, and it's a hot topic right now. And I think there's a lot of misinformation out there. There's a lot of confusion. There's a lot of experimenting going on. But the great thing about that is there's a lot of interest. And so that's a great opportunity for a little bit of education on this hot topic. So to keep it super basic to start, what are peptides?
Yes, okay. So peptides, by definition, are just a sequence of amino acids. So in biology, you have proteins, right? So proteins, carbohydrates, fats, those are, we talk about macros, right? So those are the things that we eat. Those are mostly what makes up our body. Proteins are amino acids. There's like 28 amino acids, and they link together in a specific sequence. And the specific sequence tells your body what that peptide is and what that protein is.
Okay.
Peptides are just short proteins. So a peptide is 50 amino acids or shorter.
Okay.
A lot of peptides are like 10 to 12 amino acids long. So the amino acids are these building blocks, and they'll be in a specific sequence, and that's like a code telling your body how it works.
Okay.
So let me see if a good way to describe it. Insulin. So insulin is a peptide. A lot of people know what insulin is for. It helps your body regulate blood sugar,
Right.
and it's created by your pancreas. So your pancreas makes this specific chain of amino acids. When it gets released into your bloodstream, that specific sequence will go and bind to a receptor. So we used to talk about it as like a lock and key model, but basically each amino acid sequence, each peptide, has a specific function in the body, and your body can read it like a message.
So it's not just specific to one area. The peptide itself can be specific, but you have peptides that are involved in all different types of physiological processes in the body.
Your body makes like 30,000 different peptides.
Wow.
Yeah.
And that's all about that sequencing and how long they are, how short they are, and
Exactly.
then what they're going to bind to and help set off as a reaction in the body.
Yep. You can have proteins that are 400 amino acids long. You change one amino acid in that sequence, it's a completely different function.
Wow. So highly specialized.
Very specialized.
I mean, the body is innately intelligent, but then when you start talking about introducing these like as an exogenous source, how does that work?
Yeah.
What are the different forms? Like, how are people taking these?
Yeah, so we talked about kind of what peptides are. They're these specific sequences of amino acids that code information, and they tell our bodies to do something. Our bodies, when we're younger and healthy, produce a certain amount of all these different peptides. There are peptides that help with blood sugar regulation, like insulin. There are peptides that help your immune system. So when we're kids, we have this gland that's called the thymus, and it's a big part of your immune system. As we get older, it shrivels up and dies. It just pretty much goes away, which is really sad. But
I'm like, do we not need it?
well, I know, kind of, right? We kind of do need it. So there are peptides that you can take that when you were younger, your thymus made a bunch of them. And as that thymus gland basically kind of shrivels up, you're not making them anymore. We can make them in a lab and give them to people to help with their immune function. So we'll talk about a few of the different types, but how to take them. So most of these, like insulin, you inject because, like we talked about, peptides are amino acids. They're like proteins. So the common thought is if you take them orally and you swallow them, they'll kind of get broken down just the same as if you were eating protein from like a chicken or egg or beef. There's a few that you can take orally. Most of them, though, you would do as a shot, a little insulin needle shot. There's some that are creams that you can put on, and then there's a few that you can take what's called sublingually, so you let them dissolve under your tongue, and they absorb straight into the bloodstream from there, as opposed to swallowing them and them going through like your stomach and getting absorbed that way. So there's some debate whether things that you swallow, the peptides that you swallow, are effective or not.
Okay, and if someone were to come see you because they had heard this buzzword about peptides, they want to get peptides, do you prescribe all of those different routes of administration based on what the person needs? Is there like a preferred way of doing that, like as a professional?
Yeah, so it depends on the peptide. There are some peptides that, it absolutely won't work unless you do them injection. There's some that will work okay, but not as good if you don't do them injection. So we talk to the patient and see, what they can handle and what they're trying to accomplish. A good example of this is one, it's pretty popular now, it's called BPC 157, which is body protecting compound. It's an amino acid that your stomach actually makes. Like naturally, normally healthy, your stomach makes this body protecting compound, and it helps heal all different sorts of tissue. So in the body, it'll help you heal like stomach ulcers or other parts of your intestines. That's kind of what it's made for. So you can give it, they give it a lot for people who have like IBS or IBD. They'll give it to them orally because you actually want it to come in contact with your digestive system, because that's where they want it to do the healing. But you can also inject it into your body, and they use it a lot for healing like ligaments and joints, body-wide inflammation. It can be really helpful with, so it depends on where you're trying to get the action, whether we prescribe it to be taken and swallowed in a pill or given in injections.
Well, it still, at the end of the day, seems highly specialized, not just from like a, starting at like the sequencing and what we want to use it for. I've had a lot of people who, have asked me questions about this just from like a very general perspective, and it doesn't seem that in the general public there's a lot of knowledge about how specialized these really can be. Like this is not something that's like super cheap. So to be able to get the biggest bang for your buck, to be able to address what you actually need to be addressing in your body, like this whole idea of ordering a one-size-fits-all offline is what I'm seeing a lot. So first of all, how safe is that? Because my first thought as a doctor is always like, is this a public safety issue that they're just ordering something offline without any guidance? Like how is that regulate? Like, what is going on with that?
Good question. So peptides have been used in the bodybuilding community for 30, 40 years.
Yeah.
And actually that's where we have a lot of anecdotal information about how to use them, what some of the side effects may be, things like that. There are places online that you can buy peptides without a prescription, but they will say very clearly on the bottle, like, not for human use. They're considered research molecules. And I don't know, the issue with buying these offline is you don't really know the sourcing, nobody's overseeing them. When you're injecting something into yourself, you want to make sure it's sterile. That's the biggest concern that I have is we prescribe them through a compounding pharmacy. And the compounding pharmacy, the FDA comes in and they check and they make sure everything's up to regulation. They have sterility testing, they have potency testing, so you know that what you're getting is safe and effective. When you're getting them offline from these other places, we just don't have any of that information. We don't know how potent they are, we don't know if they're going to work, and we don't know if they're sterile and safe. And really, you don't know what's in there,
right?
Honestly. So I always caution people, if you're going to get them online, as far as the sourcing goes,
it's questionable.
It's questionable.
You're taking a risk either way. Like, you have to look at the risk and reward.
Exactly.
With that.
So as far as the sourcing goes, be careful with that. But also, I caution people to try to not take it into their own hands, because a lot of these peptides, people use them with protocols. So it's like, if you want to gain muscle, do X, Y, and Z. And the reality is not everyone's body behaves the same way, and not all of these peptides have zero risks, right?
Right.
Some of these peptides can increase your cortisol, which is like your stress hormone. Some of these peptides can increase prolactin, which is a chemical that your brain produces that really should only be high in women who are breastfeeding.
Right.
And so you really want to have somebody who knows what they're doing be able to check these levels and make sure that you're using them appropriately. The other thing is, these are a tool, right? So the analogy, we're sitting by this lovely fireplace, the analogy that I use with patients is, if you're building a fire, you need to make sure you have enough wood there, and you can use some lighter fluid to kind of get it going. But if you are having this big fire going and you're putting a bunch of lighter fluid on it to really make that fire burn brighter and burn hotter, if you're not continuously replenishing and putting more wood on the fire, it's going to burn out, and then you're not going to be able to have a fire anymore. And so I've seen this a lot with patients where they get on these peptides, and the peptides will rev up their system, right? A lot of times people use these peptides for, for growth, for weight loss, to increase hormones, but most of the time, these peptides are asking your body to do more work, either to heal, to put muscle on, to burn fat. Innately, they're asking your body to do more things, and if you're not giving your body the resources that it needs to accomplish these things, then you're going to end up burning through all your firewood and kind of crashing at the end. Yeah. And this happens a lot with people with specifically like their adrenals, right? You're asking your body to rev up, you're able to exercise more, you're feeling great, your mood is better, like all these things are improved. But if you're not kind of taking care of the adrenals over the period of, 5 to 10 years, I mean, it takes a long time, so people don't associate it, but you're kind of burning through that wood at a faster rate than you're putting it on if you're not addressing and making sure you have your adrenals taken care of. And then once you burn through that wood, it's much harder to restart the fire than just
if you did it properly
than if you're
to
just
begin
tending
with.
the fire. Exactly. So you really want to make sure that you have a practitioner that knows what they're doing and knows you. Some people already start with a low amount of firewood, so you really want to work on rebuilding. I had a patient whose friend was taking one of the peptides, and her friend had been a patient of mine for years. So we had done all the foundational work. Got her gut healed, made sure her adrenals were taken care of, all of those things. And then when we put her on the peptides, she felt great. So then when we put her on the peptides, she felt awesome. So her friend came in and said, I want to be on those same peptides. And I said, whoa. I just met you, let's see where your health's at to begin with. And her adrenals were already on the lower side. She was having fatigue, she was having trouble losing weight, which was why she wanted the peptides. And I told her candidly, I said, I can't put you on these right now, ethically, because I think that you're not going to have as good of a response, and this is actually going to create more problems down the line for you. So we worked for a couple of months on getting her adrenals up and running. She started feeling much better. Everything got better because she was doing the foundational work. Then when we put her on the peptides, amazing, right?
Yeah.
And so I think that that's like a safer way to do that. So down the line, she has less problems.
Well, like you said, it's also just about that energy expenditure. Like, if you're asking, it's the same thing with working out. Like, if you're asking your body to do more work, it should be in a very focused and systematic way, and not just like, let's run around and try to burn all the calories. You might need that energy for something else.
Exactly.
That is even more important than trying to level up and optimize. So doing that foundational work and being able to work with someone who can pinpoint, well, what is that foundational work? Because, we walk around just like a regular human in day-to-day life thinking we have one priority, like my priority might be weight loss. That might not be my body's priority.
Absolutely.
There might be
Yes.
many steps before my body is going to think that that's even a relevant thing to look at.
Exactly.
So, but with peptides, I mean, it seems like they can do anything. Like
they do. There's a lot, right?
It just seems like there's a lot of ways to go. So those protocols, I could see, why that would be appealing to somebody. It seems like an easy approach, but I love your example with the fire because that makes so much sense. It's like a powerful tool, but like, which tool do you want to use to actually get the best result? Like, I could put a screw in and hammer it, but that's actually like not the most efficient way to get a screw in. Like, you need a screwdriver. So yeah, like, who's helping with those building blocks and those puzzle pieces, and can you really get that when you just say like, oh, this advertisement looks great online, let me order it, and like, you might be feeling better, but are you burning through your fire and your firewood and not having anything to replenish?
Exactly. So we look at them in our practice as a tool, knowing how to use them properly. They can do a lot of incredible things, I will say. They can do things that I've not seen people be able to achieve really any other way.
Can you share some examples of some things that you're seeing really good success with treatment with peptides?
Yeah. So I had a patient. Well, the patient I was just telling you about. I've had patients who have had body-wide joint pain for a really long time. And we do things to help their body decrease the inflammation and to help stop more degeneration from happening, but to really get their body to heal so quickly, the BPC and there's one called thymosin beta 4, both are helpful to regrow kind of like ligaments and tendons. So I have a patient after 5 days of being on those particular injections, her joint pain pretty much went away. And we'd been working for several months on her digestion and her hormones and all these other things. She's feeling great. We avoided hiatal hernia surgery, so her stomach kind of had popped up through her diaphragm, and she was having a lot of problems, wasn't sleeping well, and so we did the stuff we normally do, and she was sleeping a lot better. Her symptoms had completely gone. She was not having acid reflux. She could digest her food properly. Everything was getting better, but she was still having this joint pain. And so adding that in for her, I've never seen 5 days go from like a 6 out of 10 to like a 1 or 2 out of 10.
Wow.
Right. And so her body is actually starting to heal that damage faster than I've ever seen, even with things like PRP, prolotherapy, those types of those regenerative injections. It's really kind of amazing.
That's incredible.
Yeah.
Well, and also like allowing your body to do what it innately knows how to do.
Right.
Like sometimes when we say optimization, like we think that that's like some bonus. Like it's like, oh no, I've gotten to like my best self, and then optimization's like above that, what I couldn't even imagine. But optimization also works within that structure, like within recovery. Like how do we optimize this process of you healing your own
exactly.
tissues?
So for her, if we had just started with that, those peptides, I don't think it would have worked as well because she wasn't digesting her food. She didn't have adequate protein. She was malnourished because of all the digestive things that were going on with her. So I think if we had started the peptide earlier, she wouldn't have noticed as much of a result because her body was still dealing with all this inflammation in her GI system, and it didn't have the building blocks that it needed. But once we cleared out that inflammation, once we kind of got her up to being to functioning a little bit more normally, then we added this in, and her body was like, thank you, yes, okay, let's do this.
Now I know what to do.
Now
I have the energy to
I have
do
the
it.
energy, the resources. The sleep was the biggest one for her, and we use this peptide called DSIP, which is Delta Sleep Inducing Peptide. It is my personal favorite peptide because I love sleep so much. I've used it with several patients who have noticed just a lot better quality of sleep. It doesn't make you sleepy, it doesn't sedate you, but it helps you get that nice, deep, restorative sleep. And sleep is when we heal, right?
Yeah.
So she wasn't sleeping, she was only sleeping a few hours a night, and it wasn't good quality. So asking her body to heal every single joint in her body at night when you're sleeping, her body was like, we got 2 hours to do an 8-hour job, like,
how am I?
just not gonna happen. So getting her sleeping and getting her digestion on track, that was what was, necessary. And then we just like fine-tuned it and brought it up.
No. Well, I think,
great.
And I know, well, like we could talk about this all day.
Forever.
But I think what's important to note with like all of those examples was there was this underlying foundational piece. Like if you deal with the root cause and address that, you're going to get the biggest bang for your buck. You're going to get, the biggest improvement. And allowing the body to do what it already wants to do. Like you said with the sleep peptide, this is not like something that's just going to knock you out. It's not like a medication. It's like, oh, you need to sleep more, sleep.
Right.
It's like, oh no, we're working on the underlying factor as to why you are not sleeping and allowing your body to optimize within that process, like what it already wants to do. Very cool.
Yeah. There's some really cool peptides out there. A lot of the peptides, like we talked about the ones from your thymus gland, a lot of them you make in much higher amounts when you're younger, and they naturally taper off as we get older. So for me, finding out, and this is like the natural progression of aging versus if you've been living in a toxic city for 30 years, and then you're like, oh, my skin's not great. Well, it's maybe not normal aging. It's maybe that you lived in, a city with a lot of pollution and stuff for so long, right? So there's that difference. But natural aging, we do produce less growth hormone. We do produce less of these peptides as we get older. And so this is a big part of the peptide movement. And what a lot of doctors are using it for is restoring your body's amount to when you were younger, right? So getting those levels up to closer to what they were when you were in your 30s.
Yeah, well, like you said, I think originally why there's so much anecdotal information on peptides is like the bodybuilding community. Like you heard about it from athletes first. It's like, let's get a little biohacky with this and see what peptides can do. And now like the anti-aging movement is really like the hot area that's like spreading all of this information about peptides. And yeah, that like works into the construct for anything, like, oh, you don't heal as well as you age. Well, peptides can help with that. So I think that's where a lot of the information will continue to come out. And it's very interesting to see that differentiation between environment versus your body is naturally going to do X, Y, and Z. So how can we help support that so you still feel good and have an amazing quality of life?
Right. And so there's this conversation about health span versus lifespan, right? And so lifespan is how long you live. And we know now that our lifespan on average is getting longer and longer. We have antibiotics, we have all this new medical technology that can help prolong people's lives, but we haven't quite caught up with the health span. So we can get people to live till their 70s and 80s, but a lot of people are getting these chronic diseases when they're 60, 65. Right. So they're living for 15, 20 years with a chronic illness, diabetes, hypertension, cardiovascular disease, dementia, Alzheimer's. These are, the kind of diseases that people are associating with, getting older and end of life. What we want to do is help to extend your health span so that it matches your lifespan, so that you are healthy and vital and vibrant up until you basically are ready to not exist anymore.
Yeah. We got to catch up with that.
I know.
But that's the movement. That's the root-based medicine movement.
Right. Because if you ask people, do you want to live to be 120, but you get sick at 65 and have to be on meds and all these things for the rest of, that lifespan? Or would you rather live to 80, 85 and be super healthy up until the last, 5 years or so?
Exactly.
Across the board, all of my patients are like,
yeah, let's do that.
Let's do the second option.
Please.
Yeah. So just, when people, and I'm sure a lot of people listening to the podcast do their own research and they hear about people, they hear other podcasts, just make sure that you're listening to whether they're talking about lifespan extension or health span extension, because there's definitely things that you can do to expand your lifespan to live longer, but we want to make sure if you're doing that, you're also taking care of being healthy that entire time.
Yeah. Mm-hmm. Well, you already went into my last question, which was any tangible takeaways for listeners, like anything you want to just either pull from this or your general practice that you think people should be paying attention to. I think the health span versus lifespan is an amazing one, because we get a little caught up in that sometimes. Like, oh, people are living longer. We have all these new innovations. What does that look like? Right. So any other takeaways, last thoughts, things that people can be doing at home?
Yeah, so a couple of easy things, basic foundational movement is really important. All of the research coming out is showing how important movement practices are. I know that's a big passion of yours. So making sure you're getting up and moving. Fat is actually almost like a gland, in the fact that fat produces inflammatory chemicals, and muscle produces kind of these anti-inflammatory. So you want to make sure that you're keeping your lean muscle mass up as you age. That's really important for several different health span extending pieces. Clean air, clean water, getting out in nature, all of those things have really positive effects on your health span, right? Good food, diet, we can talk about all those things, but fasting. Fasting is also one of the things that is coming out in the literature to be able to increase lifespan, but also health span. And there's different ways to do that, the intermittent fasting, time-restricted eating. The Prolon diet is a nice way for people to do that at home. So I would say those are things that people can start doing now. And if you're on the younger side, let's say you're in your 20s, 30s, I'm a big fan of getting baseline labs. If you're feeling good, we want to know where you are on the spectrum so that you can say, in your 40s and 50s, my healthy level of testosterone was, 1200 versus my healthy level of testosterone was like 900. We want to see, because then we can compare a healthy you to an older you. Yeah, I love acupuncture. In my schooling, actually, we learned acupuncture, and when I practiced in Arizona, we could practice that as part of our scope. For me personally, it's one of the few things that is the most impactful. I think different people and different patients respond to different treatments. For me, acupuncture is like, you throw some needles in me, and I immediately feel better. It's crazy, I immediately feel better. I love the auricular acupuncture. For me, is really impactful. Again, I think having a practitioner that knows what they're doing is so important. I have lots of patients who say, I've tried acupuncture and it didn't help. Well, was the person who was doing it, did they know what they were doing? Did you do it consistently enough? But yeah, I think acupuncture is probably one of the most effective tools that we have, at least for me, for a lot of conditions. Cupping, I think, is great. Like I have patients who really benefit from that. Again, somebody has to really know what they're doing and use it intelligently as a tool in light of everything that's going on with the patient.
All right. Well, Dr. Bender, thank you so much for being with us today. I loved having you here, and I feel like we're going to put me on peptides. Very specialized approach from you.
Very specialized approach.
And then we should do a follow-up.
I love that.
See how that went.
Perfect.
So, thank you again for coming.
Thanks for having me.